Liquid diet basically starts one day after the surgery, the day that you begin drinking liquids. Normally, here at Mexicali Bariatric Center, we begin with the blue dye and then the clear liquids, tea, apple juice, and crystal light. So that's considered day one. Usually it's one day after surgery with a gastric sleeve and around 2 days with a gastric bypass or DS. Chewing gum is a tricky question. Gum actually is not a big problem. It can give you a little bit of gas. So when you chew gum, you can feel this tension and you can feel a little bit more bloaty and gassy. On the other side, a lot of patients say that gum make them less gassy or they make the intestine move. But the risk after any bariatric surgery, if you chew gum, there's a big risk that you swallow that gum. Your stomach, it will be very small, so gum can clog your stomach, and that will be a major complication because we need to go endoscopically and remove that gum. So we advise not to chew gum, especially the first 6 months after surgery. Vitamins is a very important issue. Bariatric patients need to take vitamins after surgery, but then vitamins normally give you hard time with the stomach, especially the first month. So there's no need to take a lot of vitamins on the first month. We advise to begin taking your vitamins when you're eating regular meals or when your stomach suits down after surgery, and that's around 1 month. And we advise to take any chewable vitamins, liquid vitamins, or gummy that normally give you a little bit less discomfort. Right now there's even vitamins in a patch that you can wear all day long and have the vitamin supply. What we advise is do not stop taking vitamins because mostly of the deficiencies come after 1 year or 2 years, not after the first month of the surgery. So take your vitamins every day or wear your vitamins every day. Don't stop doing it. There's another question that everyone talks about and no one wants to talk about, and it's about sex. It's laparoscopic surgery, very small incisions. So what we normally tell our patients here at Mexicali Bariatric Center is you can have sex as long as you're not in the hospital, return back home and just have normal sex. And don't do anything crazy, don't jump from the bed or don't do a lot of effort, but you can have sex without any problem after the surgery. You can start driving after 1 week of the surgery. Driving is not a big issue, but the natural response of the body when something happens when you're driving is to crunch yourself, and then you can harm all your stitches. So we advise avoiding driving, especially on a long distance. The other thing about driving is if you drive for 3 or 4 hours, your legs will be bent and then you'll be sitting down so you don't have all the walking and the risk of embolism increase. So we avoid driving the first week of the surgery. Then after that, if you're driving for more than 2 hours, stop every hour and then walk a little bit around your car, 10-15 minutes of stopping by, it's fine. We advise that you begin exercising after 1 week of the surgery as long as you're not using your abdominal muscles. That means no crunches, no abdominal effort. And the same thing applies for lifting heavy weight. More than 20 pounds after the surgery is too much because even though the surgery comes with a very small holes, laparoscopic holes, you still have the risk of a hernia. After 6 weeks of the surgery, you can resume natural routine of exercise with heavy weightlifting or a little bit more intense training. We advise that to begin with walking, elliptical, treadmill, and you can go to a swimming pool after 4 weeks when all the incisions heal. Walking is one of the most important things after bariatric surgery because that will increase your muscle mass and you'll get rid of the fat. As well increase your metabolism, it'll make you feel better, and the healing process is much faster. Compression garments are not a must, but if you feel more comfortable with it, you can use it. There's different brands in the market. A lot of patients use the one that they're like a shirt or like a girdle. You can use a compression garment after you return back home. It makes you feel better. Just make sure that it doesn't get too sticky to your incisions, or make sure that if the compression garment is too tight and you don't feel comfortable, stop using it. But there's no need for a compression garment, but if you feel more comfortable with it, it's perfect for us. Coffee, Coffee, it's a tricky question. Yes, you can drink coffee after surgery. We advise to take it after 3 or 6 weeks after surgery. There's a lot of myths. You can drink coffee after 3 months, but basically if your stomach is not very irritated, if you don't have a lot of acid, if you don't feel discomfort or nausea, you can drink coffee after 3 weeks of the surgery. If you do feel nausea, if you have irritation, well, we advise to stop drinking the coffee or increase the acid suppressant medication. Soda or any pop beverage, it's a no, definitely. Gas make a big bubble in the stomach, and that bubble cloud inside the stomach can stretch, you can feel tightness, you can feel pain, you can feel a lot of discomfort. If you want to drink something, let it go flat and then drink it, but there's no fun in it, so probably drink something that doesn't come with bubbles, no fizzy drinks, and go with non-caloric beverage so you will be able to drink without having the calories. Spicy food is a very frequently question. Applies the same as coffee. We advise you can use some spice, you can use some lemon, some vinegar, some chili, but don't abuse it. If you take so much of that spice, probably you can have an ulcer or you can have a lot of irritation in your stomach, and that can lead you to nausea, vomiting, throwing up, or even a gastric ulcer. Smoking after surgery is a very important question. Staple lines by itself create acid on the stomach. Smoking is one of the most dangerous things after surgery, because not only because your lungs, because the smoke and the acid on the smoke burns the staple line, and you can have the risk of an ulcer, or you can have a risk of a lead leakage. So we advise to stop smoking before your surgery. That will make a healthier recovery. And obviously if you already stopped smoking, you're into a new way to your new life, so stop smoking and then don't return back after surgery. Smoking, it's quite important to stop it because it helps with the healing process, but as well it helps you with the lungs. The same thing applies for chewing tobacco. Chew tobacco, it's very irritant and the saliva goes to your stomach, or smoking cigars is the same thing basically. Taking your pills after surgery is quite important. We advise bring all your medication to the hospital. We'll advise which ones you can take and which ones you can stop taking. The goal of the weight loss surgery is to stop taking most of your medication. Sleep apnea machine probably is the first one that goes away. High blood pressure medication is the second, and then diabetes medication or any other medication goes very often. What we advise is check with your PCP before you come here, so we know that all your medication is crushable or you can chew it. If it comes in a capsule form, we advise to put it on water until it goes soft and jelly so you can drink it and it doesn't stuck to your stomach. If you have a pill, you can crush your pills and you can take it normally with a very small amount of water or dilute it in apple juice so it breaks the flavor. But we advise do not stop taking your medication unless that it's under medical supervision. Thank you again for watching us. If you have more questions or if you want to do the more frequently asked questions of gastric surgery, just let us know and we can make another video. Well, see you soon. Thank you.